Hello, I'm Ryan Ferdyhert with the Center for Practical Bioethics, and this is the Clinical Ethics Corner. The doctor-patient relationship is the fundamental aspect of all medicine. People seek medical treatment or advice when they are sick and seeking help, and medicine is complicated and only becoming more complicated. So when a patient seeks advice from a healthcare professional, they are putting themselves in a vulnerable position. How will they know that the medicine that they are given will work? How do they know that surgery is maybe not the best option? How will they know what to expect next with their disease? All of these questions rely on the doctor-patient relationship to be strong, but more importantly, rooted in trust. Patients need to trust their providers because without it, medicine cannot work as intended. This makes keeping and maintaining trust extremely important. Even from the beginning of organized Western medicine, the Hippocratic Oath recognized this and made practitioners promise that whenever they go into a patient's home, they would enter for the benefit of the sick, and that whatever they see or hear in the lives of their patients, whether in connection with professional practice or not, they will not speak of it outside, maintaining confidentiality. But this does not mean that providers are entirely at the subject of their patients. Providers need to be able to act with their best medical judgment, and sometimes that requires telling patients things that they may not want to hear, no matter how true they are. Providers take an oath to give to their patients. So when is it acceptable, ethically, to eliminate that relationship? There are two major causes of ending a physician-patient relationship. One is when the patient makes threats to the provider or the provider's team. If there is a threat of violence against a healthcare worker, it is often seen as ethically permissible to stop providing for that patient, as healthcare workers should not have to risk violence to themselves or their families in the course of providing for patients. Another situation is when trust is lost or not present at all. I remember working with a pediatrician, and I asked him, just hypothetically, what would his response be to seeing a patient who refused vaccines for their children? He said straight to me, I would ask them to find another doctor. I was a little struck by that, and when I asked why, he said, because it implies that the patient does not trust me. I believe in vaccines, and I believe in the benefits that they provide. If my patient is not trusting me on these, how can they trust me on even more challenging matters? And if they don't trust me, I cannot be a good doctor to them. I would recommend they find another doctor that they can have that relationship with. So I would dismiss them, but only in also referring them to another provider, because that patient deserves to have a trusting relationship with their doctor. And if they are refusing vaccines, then they likely won't establish that relationship with me. I found that deeply meaningful. It was ending a patient relationship, but only because of a lack of trust and therefore not able to provide properly for their patient. Healthcare workers should trust that they can provide for their patients safely, but also with a trusting manner. That is a necessary component of health going forward. Thank you. This has been the Clinical Ethics Corner. I'm Ryan Ferdyhert with the Center for Practical Bioethics. Thank you.